The following segment is sponsored by Citrin Cardiology. We are once again joined by Dr. Citrin, and we love having Dr. Citrin in studio. You bring us so much knowledge. And of course, in our last segment, we were discussing procedures used to remove blockages that could cause heart attacks. So when are medications the right course of therapy for a heart patient in lieu of open heart surgery?
Well, in most people with heart disease, there's some medications that are always indicated. Sometimes we use medications to prevent blockages from forming in heart disease, and then that's called primary prevention. Oftentimes we use medications after somebody has an issue to prevent further strokes or heart attacks down the road.
And then what are some common medicines used to reduce risk factors?
There are 4 medications that we tend to use, and
Okay.
this is pretty much in most patients with heart disease. The first are called blood clotting drugs, platelet drugs, where we try to prevent the sticky things in the blood from clotting off. And those are drugs like aspirin, Brilinta, Plavix. Anybody who's had a stent or stroke or that sort of thing is very familiar with these drugs. We also use drugs called statins, the cholesterol medicines, Lipitor, Crestor, Zocor, a few of those that we use. And they prevent the blockage from forming and also stabilize it. And then we use a whole bunch of different blood pressure medicines to get the blood pressure down around 120/80. And finally, the medication that we use in most people with heart problems is beta blockers. The toprols, the betas, and carvedilol, Coreg, the medications that we use quite a bit of the time.
And you mentioned the aspirin. I know my dad used to take that frequently every day. So how do you make the choice of different medications, Dr. Citrin?
Well, part of it's, I like people to work with their doctor as a partner. So I think everybody should find a doctor that they like and they trust and work with them to tailor to their diseases and what's going on. And you basically do that, what medications they can afford, which is a big deal, which ones they can tolerate, and sometimes you have to try several medications to get it right.
And you mentioned medications that you can afford because it can be pricey when you're on multiple prescription medications. So are these generic medications the same as the name brands that we've seen?
Pretty much the answer is yes. They're pretty equivalent. There are some exceptions, and unfortunately some of the newer medications, which are great, you just have to take those until they become generic, which is usually 5 to 7 years after they're released.
Okay, and are there any cost-saving tips for buying different medications? We need your help.
One thing is to see if you can get the medications as a 90-day prescription as opposed to 30 days, because a lot of times that's much cheaper. And then we use this app called GoodRx, which we have our patients download. And you can go to this app and it will give you cheap prescriptions or paying them by cash, a cash prescription nearby, and usually you can save quite a bit. It doesn't go through insurance, but it's amazing sometimes the savings.
Right, and especially I would assume if you're on something consistently, then it would make sense to buy it in bulk anyway and help save money. Well, thank you so much coming in once again, Dr. Citrin. If you want to swing by, of course, he's located on Airport Boulevard. Give him a call or visit his website. Thanks again, Dr. Citrin.